Staying on top of your health is hard, and the system is extremely confusing. Personally, I've had to navigate my parents' health needs, trying to navigate almost 4 or 5 specialists with each one asking the same questions, and it's uncertain if any of them have talked to each other, which they likely have not. What that ends up doing is having delays in care. You end up not knowing something, and so you don't take your meds, you don't pick up that medication, it exacerbates, and that's exactly why we've built Flora.
Hey there, I'm Flora, your AI care advocate. I understand you need some help. Tell me what I can do for you.
Flora is a care manager, a social worker, a community health worker that's been built and trained as part of a high-performing care management team and medical organization.
Flora is built on top of our years of experience of delivering whole person care in the community that addresses people's clinical, behavioral health, and social needs.
We see Flora as an AI advocate who can help patients navigate the healthcare system and stay on top of their general life needs.
So whatever you are looking for as a patient, Flora is your first call and your go-to for whatever that need might be. Whether it's a clinical question, a need for a new prescription or a refill, concerns about your mental health, or even social needs like food insecurity or difficulty with transportation, Flora is the place to go.
We built Flora alongside our care team. Care team is a medical group. We have over 600 care team members that are engaging patients day in and day out.
She works with our own care team where we have licensed nurses, nurse practitioners, and physicians on the team to whom Flora can escalate clinical needs, and our care team can jump in to help address those for you as well.
Flora is a part of your care team. She is your advocate, available day or night over text or call for any health need. A game changer is how simple it is for the patient. I think it's no secret that people don't like downloading another app or having to log into another system. The beauty of Flora and AI care management is that you can interact with her just like you would anyone else on your team, over text or over phone. You can call any time of day, and Flora is there to talk you through your care plan, to help check in on the status of a specialist referral, or even to just check in on how you're doing and your mental health.
My first impression of Flora was less about Flora and more about how the patients actually responded to her. She really digs into a patient's goals, how they actually think about their health. I was surprised how much a patient opened up to her and the genuine connection she was able to make with the patient. And that's something that as a clinician, we typically have to really work with the patient to obtain their trust first, which is why Flora is really interesting, because she gains that trust almost immediately is what we see. And she's able to listen and respond empathetically to really get the patient involved in their care and ready to move on to next steps in their health or securing, social needs. One patient even said, "You elevate my happiness," and it made me tear up.
We've seen those calls go over an hour where people are telling their entire life story to Flora, and we can then use that information to offer them a better support experience.
So as a nurse practitioner, my time with each patient is incredibly limited. Patients are often only able to get maybe 2 or 3 appointments per year. And so what Flora does is keep the patient engaged in between that consistent thread running through their life when I can't be there. She offloads the work I don't need to be doing myself. She gets the patients to focus on their goals and key needs instead of chasing refills and check-ins.
Flora is for everyone. We see people across the entire spectrum of needs using Flora to improve their health. On one hand, we have patients who are homeless, living on the street or in their cars, who connect with Flora and who are able for the first time to identify someone who can help them and meet those basic social needs to get them into housing, get them a source of healthy food, and really get them on a much better life trajectory. We also have people who are more like your average Medicare beneficiary, who are facing tough choices about the cost of medication and the cost of food or rent, and we can help navigate those exact type of questions. all the way through to people who are looking for support on a day-to-day basis around meal planning to help keep their diabetes or high blood pressure under control, or prevent their prediabetes from progressing to diabetes. And so Flora is really designed for the entire spectrum of Medicare beneficiaries. And depending on what you tell Flora you need, she will create a customized care plan that is designed specifically to support you.
When we talk about Flora, some people assume that it's a single agent. That's not true. It is actually a personalized AI advocate tuned to every single patient that we serve to understand their health needs, their life situation, and ultimately fit the care plan into their life and not the other way around. What excites me the most about AI care management isn't technology, it's about what makes it possible. A world where your health outcomes are no longer determined by whether you know how to navigate a broken healthcare system.